Person says to a hospice patient, "What's it like to know you're dying?" And the hospice patient responds back, "What's it like to pretend you're not?" I'm going to talk a little bit about the role of an end-of-life doula, which is a relatively new term, but not something new. As long as we have been living and procreating, there have been people that have been supporting others in dying. We just haven't called it that. We used to do that in families. We used to do that in communities. In our community, in our society, we have gotten away from doing that. We have gotten into pushing death as far away as we can. Unfortunately, what that does is it makes us death averse. Similar to a birth doula, which is someone who is going to assist someone before, during, and after childbirth. An end-of-life or a death doula is going to do the same thing for someone and their families, however that family is constructed, of loved ones during the dying process. Each end-of-life doula can facilitate essential connections between the dying individual and significant people in their lives, including out-of-town family who can't be there to watch over their loved ones, can't spend the time giving them the support. They can connect with hospice teams, palliative care teams, and other relevant resources in the community because they're familiar with them and they have the time to do that. They make the time. Dying and death aren't easy topics to discuss. When we talk about death, it brings us face to face with the reality of our own mortality. And for some, it's not comfortable to have those discussions. Doulas are comfortable with having conversations that may never otherwise happen. And they're trained to be exceptional listeners. Death doulas can begin working with clients and their families at any point in time. They can engage as soon as a person learns of a terminal diagnosis. They can engage with families when the dying person is closer to death, relying on services for emotional and spiritual support when they feel the most unprepared and the most frightened, which is toward the end of a person's life. And some people seek doula services to discuss their planning in advance of even being diagnosed, when they're doing advanced planning and preparation for what if. Doula services can be provided alone or in conjunction with other traditional healthcare services, such as palliative care, hospice care, or even primary care. While hospice does provide interdisciplinary, holistic support, and an end-of-life doula can offer support in ways that hospices cannot cover and don't. Many families are surprised that once hospice care is provided, much of the care is still provided to the dying and rendered by the family, by people at home, or people that are their natural caregivers. Most hospice patients are initially seen by hospice nurses 2 to 3 times a week for approximately an hour, not round-the-clock care, which is what families are hoping for. What services might a doula offer? Each doula offers different services depending on their skill set and their training. And there is now doula training that is available. Doula training through a number of different schools and practices. It used to be that we grew up knowing what to do when people were dying because we were around it in our grandparents, in our great-grandparents, in our children. We don't get that anymore. It's pushed to the medical providers, and we don't see it. And we saw the results of that during COVID. During COVID, we couldn't be with our loved ones. They were with strangers, and we saw the impact of that. And a lot of people after that started turning back, going, wait a minute, I want to know more. I want to know more about what I can do. Doulas are teachers. As a teacher, my best experience, and when I think I've done my best work, is when families tell me, Kris, you can step away now. We got this. we're ready for you to go and for us to take over. Because they're now feeling the kind of comfort that I feel when I'm sitting with someone. How are doulas paid? Doulas are paid, unfortunately, still out of pocket because they're not certified. It is a new field, so they're not recognized as being reimbursed by the government. However, even in this community, a lot of doulas work on a sliding scale, and some of us even work pro bono, depending on the situation. How do you find a doula? You find a doula by going out into the internet and look it up.